Kia ora, talofa everybody, I'm Trina. Thank you for watching. This is my beautiful friend Puhi. That's come in straight after Mahi, of course, still in her uniform, so I thank you for that. So our bit of a backstory is we both nurse at the same hospital, and way back post-COVID, I remember seeing Puhi in the villas at the hospital, and I thought to myself, no, I know Puhi is a ward nurse. And then when I asked her, what are you doing here? And then she said, I've had a kidney transplant, and this is all part of my Return to Mahi program. So that speaks for itself. So thank you, Puhi.
Oh, good play.
So I thought we'll go right back.
Yeah.
Well, if you don't mind, if I could ask if there was any renal disease in your whānau.
Sure. As far as I know, there wasn't any renal history with our whānau. My grandfather had diabetes, and my grandmother passed away the heart attack, and I actually think she went undiagnosed as a diabetic.
Yes, yeah.
That's thinking back now.
Yeah.
What I know now. Yeah. So. As far as renal history, no, I don't think so.
That really struck you, like on Nan's, Nan's having treatment or anything like that.
Yeah, okay. But diabetes is a in the history of our whānau. So yeah.
Okay.
Yeah.
So before you yourself were formally diagnosed, how was life? Like, were you thinking, I'm well enough, I'm educated, I'm articulate, the ward you work on, renal and respiratory, so you're seeing it daily?
Yeah. I guess for myself, I've always been quite active and quite sporty, and then I did the training. I moved from Gisborne to Napier at EIT to do my training. So with studying and stuff like that, sort of stopped the training and things. So you sort of put on weight, and because you're not as active as you as I used to be. And then I think it was at 2000 and about maybe 2005. I was diagnosed with diabetes.
Oh, okay.
So it sort of started from there, just slowly crept itself into what happened with me with the renal failure, with the chronic.
Okay. So when you were diagnosed, did you take it seriously, or did you park it back in your mind?
With the kidney failure,
with the diabetes,
I sort of parked it, sort of in denial.
Yeah,
in denial. They had put me on medications. With metformin, we all know what metformin does. It gives you diarrhea, and for anybody who knows who takes that sort of medication. So with me playing back into sports and stuff like that, I'd rush on the field, and then I'd have to rush off again, rush on the court, and then rush off again. So I thought, no, bugger this, I'm not taking this anymore.
The metformin.
Non-compliant,
non-compliant.
So non-compliant. So I thought, no, I'm not taking that anymore, and so I didn't. I just stopped taking it, and then eventually it's caught up on me. It caught up on me and caught up on me. Yeah. So yeah. As a result, yeah.
So I think you'd explained to me that you'd lost weight.
Yeah.
And you were feeling fatigued. Putting it down to overworked, getting older. And you took yourself to the doctor.
Yeah. So when COVID hit, some of the staff at the hospital were transferred into the COVID ward. We all, some of us put our hands up, say, "Oh, yep, we'll go and work there." And then it was during that time, going home, just feeling really tired, and I thought just put it down to being work and maybe getting old, so you're getting old, so and just feeling fatigued. So I'd go home and just think, I'd sit and relax, or I'll just relax for a little while, and then I'd end up falling asleep, and then it was losing the weight that
was the most concerning.
That's what drove me to going to get my bloods done, and then seeing the doctor, and then the doctor reacting to me saying, I've got to get into to see the renal specialist ASAP. So.
And so you had an AAU stay. So talk us through that whole period from a very short amount of time,
Yeah.
you're told really big news.
Yeah, yeah. So I can, oh, geez, it's like yesterday, yeah. So they admitted me straight away when I was with my doctor. I had to go straight over to the hospital. I was told, okay, you're not going home. I didn't have anything,
No.
not thinking I was going to be admitted. So it was, yeah, they admitted me straight into the AAU unit. I was there for actually a couple of nights, but the first night there, I stayed, and then it was the next day they came in, the team, the specialist, the consultant came in and told me the news in regards to, okay, you've got acute kidney disease. You have to think about getting having dialysis done. And then down the track maybe a transplant, transplant. So, I sort of had to give my time a bit of time thinking, what the hell's just happened?
Exactly.
Yeah. But I've always been one, like I've just said, told you before, okay, what do we have to do to get it, to get things, back on track?
Did the doctors think you were too straightforward? Did they think that you'd actually taken it on board, or were they like, okay, Puhi, these are the steps we would normally take? Talk to your whānau first. Was there time for that? Or you were like, no, I need to make this decision?
Yeah. It was my decision to make, and my decision, this is what's going to happen. Yeah. You fellas need to say, okay, what are we going to do? Yeah. Just tell me. Just tell me, and we'll work on what we need to.
And so, what were the steps? Obviously, your lovely boy was your donor.
Yeah.
So, how did that come about?
Yeah. So, oh gosh, I guess when they said to me, oh, you're going to have to go on dialysis. So it was it started off with tests. It was test after test after test, and then I had to get the process in regards to getting peritoneal dialysis, which is, I'm able to do it at home because they gave me a choice on whether I could go into the clinic or have it done PD. Yeah, so the option for me was to have PD because then I could still work. Always in my mind, oh, what am I going to do?
You've got to earn.
I've got to keep going.
But I mean, your empathy would be through the roof now. But also, you've nursed patients with exactly what you're going through,
for sure.
And so you would have taken all of that on board. I mean, that is just out of this world to think that every day you're being hooked up you're hooking yourself up at home, doing a treatment, waking up in the morning. So at what point did you think this is getting a bit much, or did somebody notice that at work, or your nearest and dearest?
Oh, everybody knew. It wasn't a secret. I was quite open with it all. So they knew what was happening. They were really supportive. I was taking off night shifts, so I didn't have to do. So it enabled me to hook up at night. I guess the latest time I let myself get on was the latest would have been 9 o'clock.
Okay.
Because then it goes for your 8-hour period. And if I was working the next day, I'd have to be up about maybe 4:30, 4:35 to unhook myself, get everything, chuck all the bags out and what you need to do. I mean, anybody who's on PD will know the procedures. Thing. I really empathise with the older generation because those bags, they're
heavy. They're pretty big.
So I mean, I was lucky I had my boy at home and stuff like that, so he helped. But I could do the majority of it myself, But in some days there he'd help, and and if you forgot to close the bags, you'd wake up and the floor would be all wet. What the hell? But so things like that. But I mean, it was a process where I've got to get a tank off put in. So I had to go and get that done, and then the PD nurses would come and educate me in regards to how to work the machine and stuff like that. So did that for 2 years. 2 years. Within that 2 year frame, we were getting tests done, blah blah blah. Making sure everything, working up to the transplant.
And you just stayed on your normal roster at work?
Yes, just stayed working.
Any times where your health took a dip, or the dialysis kept you quite stable?
Pretty much. Kept me stable. If there was anything that happened out of the ordinary, we just took care of it. I don't think there was though. I think,
I mean, you're obviously really strong.
Yeah.
So how did you take care of yourself up there?
Oh, I don't know, to be honest. I've always just get on with it.
Just get on with it.
Just get on with it, yeah.
And does your son take after you with that kind of mental strength?
He's a bit more laid back.
Okay.
He's a bit more, any more laid back, he'd be going backwards. I shouldn't say that. But and I guess to the point where we, with the transplant, so when he came back, because he was in Auckland for a couple of years, so he came back, he'd come back now and then that's when I told him, I said to him, look, I'm sick, you know, I have to, my kidneys are failed. And he goes, okay, Mum, so what are we doing? What do we have to do? Yeah. I said to him, well, it might look like that I might need a transplant. And he said to me, oh, okay, would you like take one of my
just
kidneys?
Offered.
Yeah.
Wow.
There was no hesitation.
No.
Okay, Mum, I'll give you one of my kidneys. Yeah. I said to him, no. And he says, well, what's going to happen if you don't give me your kidney? Yeah. And I said to him, well, I'll probably die. I'll have to go on the list.
But just as a mother, you didn't want to put that on your son.
That's right.
Yeah.
I said to him, no, we need to think about it. He goes, no, Mum, there's no thinking about it. Yeah. And I guess in that way it's like, yeah. And I said to him, well, no, let's just think about it first. And
how long did you think about it?
Maybe maybe the next day. But I don't know. I think
you'd had 2 years of PD at home. Yeah. So in your mind, you're kind of sailing along, you're okay. But there was no kidney that was coming your way from the community.
I would have been put on the list and stuff like that, but, how long would it have taken?
And had the specialist said to you, Puhi, ask the whānau?
Yeah.
Had they put that towards you?
Yep. So I worked with the transplant nurse at the time, Erin Jones. Beautiful. Just fantastic. So she had, we had a kōrero in regards to what's going to happen, with the transplant. This is what's going to happen. Do you have whānau? Because she says, she put it to me, we know what your culture's like and stuff like that, asking for things like that.
Yes.
I always to ask, well, for a cup of milk or like a kidney, come on, So, and we get a bit whakamā, I guess, in regards to asking for anything, and especially when it comes to something like that.
Exactly.
So she said, did I have anybody? And I said to her, but people knew.
Yeah, okay.
They knew what was happening, so they were coming forward.
Really?
Yeah. Yeah.
And you always said no thank you.
Yeah. Like, my best friend, she goes, I'm going to test myself. She says, but she wasn't able to do it.
Really?
Yeah, my niece, she offered to give her kidney and stuff because she came back when she went and got herself tested.
Oh, wow.
And she goes, Auntie, I'm a match. Yeah. And I said to her, oh, okay, babe. She says, I'm quite happy to give you my kidney. And I said to her, okay, but I think your cousin's, he's offered to give me. Yeah. So, and that's...
And that's how all of that came about.
Yeah. But Mirren had to, because I said to Mirren, how's this going to affect him in regards to the rest of his life? Because he's going to be with only just one kidney. Yeah. So she says, no, a lot of people out there just are born with one kidney.
That's right.
And they don't even know it.
Yeah.
Yeah, they don't even know it until something happens later on down the track. Yeah. So she said, and there's a lot of people who've donated their kidneys and they're fine. Yeah. As long as they look after themselves and, so, which is what we should be all doing anyways. But, So I thought, okay, I took that into consideration and we had a chat. I had a chat, my boy and I. And, so we went ahead and we thought, well, let's do it.
Wow. And so... Tell me, how was all of that? So I think you went to Wellington?
Yes, Okay. It was actually before that we were going back and forwards to Wellington, having tests and seeing the specialists down there and coming back and then later on going back down again, so there was a bit of that going travelling.
Okay. And then you're still trying to do your PD in that time too?
Yeah, and working at the same time, taking days off, just my normal days off, your roster off and stuff like that. So, so it was all on. So.
Oh, heck. And then you did tell me the story that pretty much straight after the transplant was done, and then your boy, because he's one with taiao, with nature and the water, and then he took off.
Oh,
he needed to feel the water. He needed to get back to himself. You're ringing, everybody's ringing. Where is this boy?
Yeah. Well, he came and saw me when I was on after. It would have been about maybe a day after, maybe day or couple of days.
Yeah.
I'm sure it was the day after. Yeah. And he come to see me, and I said, "Oh, where have you been?"
Yeah.
And he says to me, "I've been down to Lyell Bay." I said to him, "What's that Lyell Bay?" He goes, "Mum, the beach." Yeah. I went, "Oh, okay." I thought thinking just,
Yeah.
And he goes, "I went for a swim." I says, "Oh." I said, "What?" He goes, "I went for a swim." I says, "Oh, you can't be going for a swim."
Yeah.
Yeah, you might get an infection and stuff like that. He goes, "Oh, Mum, I needed to get in the water."
Yeah.
Yeah. I says, "Oh my God."
Yeah.
Well, got back into the renal clinic here to Mirren.
Okay.
So she was ringing me up. She goes, "Oh, how's Tito?" I says, "No, he's good."
all good,
Not
yeah.
knowing she knew.
Oh.
She goes, "Oh, I just heard that they had said to me that he's been down to the beach for a swim." I says, "Oh my God, did you hear about it?" And she goes, "Yeah, we heard about it." Yeah.
Oh, look at that. But,
Yeah.
it's a credit to him because he honoured you.
Yeah.
He gave you the kidney.
Oh,
He
yeah.
did all the testing. At what age was he?
He would have been 23. Yeah, 21 was COVID.
Yeah.
Yeah, 23.
23, so young.
Yeah.
Yeah.
To take it on board.
To take it on
Yeah,
board.
absolutely.
Maybe that's the blessing too.
Yeah.
They
Yeah.
kind of,
Yeah.
our youth, they definitely.
Yeah. Oh, he's a blessing.
Yeah.
Yeah, he is. Yeah. So, and I have to remind myself that sometimes because I can
exactly.
be a little bit hard on him and trying to rush him out the door. Yeah.
So how was the recovery period for you? How much time was spent in Wellington, and what
So I
was that made up of?
I think I spent 2 weeks after the post surgery. 2 weeks there, and they were fantastic. We were put up in Ronald. We were lucky to get into Ronald McDonald because usually they don't. It's usually just the kids, hey? Yeah, but we were lucky. Mirren did her magic, whatever, so we were able to get over to, they housed my best friend because my best friend came through, and she supported. I said to her, no, it's fine.
Yeah.
We'll be. She goes, "I'm not coming for you, I'm coming for my godson," because Tito's her godson. Yeah, so I says, "Okay, whatever." Yeah. So she was with us through the whole procedure, the whole thing.
So you were laid up. Were you allowed to, how was the recovery?
The recovery was fast.
Really? Yeah. And even
I'm a bit of a
physically.
Wolverine. Fast healer. Yeah.
So physically, could you see daily changes within yourself?
Oh, definitely.
Yeah, really?
Oh, definitely. Yeah.
Wow.
Yeah. Almost. I mean, not to my old
that's
self,
right, yeah.
but definitely compared to when I was.
Oh, so
before.
unwell.
Yeah.
Yep.
Yeah.
And so the catheter had to come out?
Yes. Yep. So they
Okay.
took that out. Yeah. The kidney. So my boy went in first. He went at about 9 o'clock in the morning, and then he came out a couple
Did
of
you
hours
have Whānau
later.
with you?
Just me, him, and my best friend.
Lord.
Yeah. Rose, I told you about Rose.
yeah.
She came and visited me while I was there.
lovely. Yeah.
Yeah. So everybody was all, always texting.
And they all knew. Yeah. All of your work, whānau,
just
your
concerned
whānau.
and how everything went.
Exactly.
Yeah.
And
So-
probably knows your personality too.
Yeah.
You wouldn't have wanted the whole
No,
entourage.
no, don't make the fuss. Don't make the fuss. It's all right.
Yeah, I'm okay.
Yeah.
So 2 weeks
Yeah.
spent down in Wellington.
Yeah, so 2 weeks in Wellington. What was it? I must have been in hospital for about maybe five of those
So
days.
transferred back to Hastings Hospital.
No.
okay.
And then I went over to, we were in Ronald McDonald days for a couple of, just to keep an eye on me, but they wanted me close. So, and then maybe 5 nights in Ronald McDonald. And then from there we drove back here to Hawke's Bay.
Oh, wow. And then, so because that's where I saw you in the villa, and that was part of the return to work program.
Yeah. So I was off, all up, I think I must have been off work for about 4 months, and then back into it.
Okay.
But slowly, they put me, they kept an eye on me to make sure everything, when you return back to work after being off for a little while.
Yeah, exactly.
Yeah, they keep an eye on you, and the time was right for me. Yeah, then they put me back on the wards, and I've been back there ever since. Yeah.
Oh, wow.
I don't do night shifts.
Okay.
I might do the odd PM now and then, but they ask me. Yeah, they usually ask. The staff usually ask, and otherwise I'm on mornings. Yeah.
Oh, wonderful. So now, of course, I think you're just the absolute, advertisement for renal health. So how vocal are you?
Not how to do it.
Yeah.
Not how to get yourself into that
exactly.
situation.
Do you share the story to patients?
Oh yeah, I
that
said,
are
look,
on the
don't feel
fence?
sorry for me.
Yeah.
Yeah. I'm my own worst enemy.
Yeah.
And we are sometimes,
Yeah,
eh?
exactly.
You know, so when I talk to, because we're not so much a renal ward anymore.
No.
They're mainly on A2 now.
Okay.
Yeah, so respiratory. But when we do get renal, and I've come up, it's really funny because just within maybe the last couple of years, I think, we've had a few transplants come on the ward.
Wow.
Yeah, so we share been swap stories and stuff like that.
Yes.
So it's really interesting. It's funny, you know, how
Exactly.
yeah, how that sort of works.
And that
so,
whole full
yeah,
circle,
yeah,
you can share it. And
Yeah.
I mean,
Yeah.
I can't even believe you did your PD
Yeah.
and you worked
Yeah.
and,
Yeah,
you
yeah.
know, you just kept it all kind of,
yeah.
you know, quiet but open.
Yeah.
You know, but you
Yeah.
weren't a look at me, help me kind
nah,
of person.
No, don't feel sorry for me.
No,
yeah,
no.
yeah, I don't deserve it. I don't deserve to be felt sorry for. Yeah, yeah.
And what about the follow up?
So I follow up continuously, not so much anymore. When I first got back, it was going to see them just about maybe twice a week.
Oh, okay.
Yeah, over
Yep.
to the renal clinic, just
Yep.
just checking me, and then it slowly got a bit more spread apart.
Spread apart, yeah.
So now I must see them every 3 months.
Oh, wow. And your boy, is there follow up for him?
He was supposed to have gone to see his last appointment over in the renal clinic. I think he was due about a couple of weeks ago, but he didn't make it over there. So, but they sent a letter out to say, "Hey, this is your last checkup."
Okay. Yep.
Yeah. So
And then what about the mental health side of it? Do they offer counselling?
they at first, before the procedure, they offer counselling.
Yeah.
You know, to make sure that we're in the right frame of mind.
Yes.
Yeah, to make sure afterwards, not so
they,
much.
I was going to say, did they ever say to you, Puhi, slow down, girl?
Yeah. Yeah. Well, no, they didn't. But anyways, they should. No, well, in a way, they says, "Oh, are you still working?"
Yeah. And you would have had to say yes.
Yeah. But there was nothing mentioned about, "Oh, don't you think you should be slowing down?" But yeah.
No. Oh, well,
Yeah.
no. Well, that's good.
Yeah.
And so, do you talk openly to your whānau when you see kind of the signs, or you know that there's, or whānau or friends that you know are diabetic or renal health isn't looking that fresh?
Oh, yeah.
Yep.
Yeah. Okay, you don't want to be going down that track. Yeah. That's pretty much, because, you know, you don't want to be going through that.
Yeah, I think.
Yeah.
I think all the cards lined up really well for you.
Yeah,
You
yeah.
know, you were on the cusp of, you know,
Yeah.
renal failure.
Yeah.
And you were already there. And
Yeah.
just
Yeah.
the boy coming in
Yeah.
and the transplant took.
Yeah.
You know, that was the key. So
Yeah. So.
how's everything looking besides that with you?
Yeah, no, it's good. I mean, I can't complain.
No.
Nah. Hey, you know, I'm still above ground, so it's got to be a good day. Hey. You know, so, yeah, no, yeah. I mean, of course, hindsight, if I had known this was going to happen, of course I would have, paid a bit more attention to
Exactly.
myself.
What age were you diagnosed with your diabetes?
I would have been in, about 2005. Shucks. What are we in now?
20 years ago.
Yeah.
Wow.
Yeah.
And so 20 years ago, but really in the last probably about 7-8 years, you would have had to take it really seriously.
Yeah.
So you kind of coasted a bit for a while.
Oh, definitely.
Yeah.
Like I said, I'm my own worst enemy. You know it. I mean, for God's sakes, I'm a nurse.
Yeah.
You know?
I know. That's what struck me. Like, holy heck.
Yeah.
You know, we're that informed.
And that's what I mean. Don't feel sorry for me. Yeah, because I should have known better.
I do know. Yeah, you do know better.
Yeah, of course.
But that is how much we can put something to the side and just kind of skirt around it for
That's
that
right.
long.
Yeah.
And you were you were on the brink.
Pay attention to yourself.
Yeah.
Yeah, when you think something's wrong, hey, get yourself checked out.
Yeah.
Yeah.
And I know it's scary, and I've never had diabetes, touch wood, but when you would have just taken yourself to the doctor, I think that was the time where you had to be honest with yourself.
Absolutely. Absolutely. Yeah. But yeah. Hey.
Yeah, exactly.
What do you folks know? Yeah. So,
But no. Oh well, sister.
yeah.
Thank you. You're one out of the box. Honestly, I would never have picked you to be doing PD at home, your dialysis at home.
I think I had Tina staying with me too.
Okay.
She was flatting with me at the
And how was she?
She's good.
Yeah.
she's
How
good.
was she with you doing your own treatment and everything?
Oh, we had a good because
she's
she's
a
probably
nurse,
one of the
yeah.
ones.
Yeah.
That I told and spoke to and stuff like that. So yeah. I guess she went through the same. She went through it with me.
Yes.
because she was there and stuff like like that.
Exactly.
So yeah.
And also, I think just being clinical,
Yeah.
you do kind of
But to me, it all seems like a blur then, now.
really when you look back.
Yeah. Thinking, oh, did that happen?
Yeah.
Hey, do you know what I mean?
Exactly.
Because you just gotten on with it.
And I think maybe because it was quite a physical thing. You hooked yourself up every night.
Yeah.
You took care of yourself, so you were doing all those steps. Maybe if it's one of those ones where you took a pill and you're just waiting for things to happen. But if you weren't doing these things for yourself because you're quite a doer, you know, so you're like, okay, done this, done this.
Yeah.
That's probably been
Just do it and get it over and done with.
Yeah, it's
and
your personality.
Let's move on.
Yeah.
Yeah. So don't feel sorry for me.
Yeah.
Hey, you know, all right for me to give sympathy, but don't,
exactly.
Yeah.
I mean, you can definitely practice
Or
what
empathy,
you preach.
yeah.
You know
Yeah.
now, and look at the outcome. So
Yeah.
I'm wrapped for you.
Oh, thank you. Yeah.
But no, well, thank you, Puhi.
Oh,
Thank
okay.
you. And I've just learned so much. Like we know each other
Yeah.
from our ward
Yeah,
rounds, like,
yeah.
and I'll see you, I'll pop in, and then
Right.
every little bit of extra little information you gave me about your kidney transplant, I thought, no, I want to talk with you. I want to, understand it from another perspective. But we definitely cover a lot when we see each other on the wards, like even if it's a couple of minutes, download real quick.
Yeah. I've had the opportunity, Mirren Jones had asked me if I would be a speaker, when she to film us and to put it out in the kidney, what is it, the kidney...
Is it the Kidney Foundation?
Yes, yeah. So she had asked if I was willing to share my story. So I said, of course.
Yeah.
I mean, it's just a way of giving back for
Exactly.
all the help that they, all the help that they gave us. And she says, what about Tito? Would he be willing? I said to her, well, you'd have to ask him, and she asked him and goes, yeah.
Oh, awesome.
Yeah, so we both, she came over home and she filmed us both, and she had a few other people that she was interviewing. So, it's all out there on the Kidney Foundation.
Yeah. Were you surprised at some of the feedback Tito gave?
Was I surprised? Yeah, no, not really, because I know what he's like.
Yeah.
He might have surprised me with a few things. Thinking, oh, okay,
yeah.
But no, he was surprisingly quite good. Yeah,
Awesome.
Yeah. So, so yeah.
But no, thank you, Puhi. Thank you
That's
for your
okay.
time,
Yeah.
sister.
Oh,
Okay.
you're welcome.